today we're going to be talking about protecting and healing your brain. Most of us see the brain as a separate entity and not as part of the body, and we have diagnosed mental disorders or memory issues or cognitive issues, and we see that as a total separate issue. However, you can actually help whether you have a diagnosed or undiagnosed condition, whether we're talking about anxiety, depression, memory impairment, or tremors, even balance issues, or diagnosed neurological or degeneration disorders such as MS, psychiatric disorders, mood disorders. All of those, even the worse the diagnosis, the more care you have to take care of your brain. The more attention you have to give your brain. And anatomically, the brain is a glob of fat, and so obviously, nutritionally, it is very important to eat well and to not ingest toxins that will affect that, because a lot of toxins are actually stored in fat, not necessarily brain fat, but also the brain is quite vulnerable. So what to do to protect your brain? So we talk about the fat, about lifestyle, about exercise, even when they looked at exercising your brain, but even more aerobic exercise has actually been shown to be more effective than those brain games. So just moving and getting motions and getting your blood circulation is very important for the brain. Of course, certain B vitamins, the B12 and folic acid are very important for the brain, and some patients have some genetic, epigenetic kind of SNPs that makes them require a specific kind of folic acid and specific kind of B12, not just the common one you find at the nutrition store. And hydration. Hydration is very important. When you don't drink enough, the first symptoms of dehydration is when you get disoriented and having a dizziness and balance issue. So, and like any other health conditions, the definition of health is you being able to empty the trash can faster than you fill it. So what is harmful for the brain? Anything that's artificial can be harmful. Obviously, drugs, alcohol, cigarettes, all of that can cause degeneration to the brain. And degeneration gets translated in inflammation. And inflammation causes cognitive problems. And how can you actually diagnose inflammation in the brain? Interestingly enough, if you have access, if you can get an MRI, and if you already have neurological disorder, it's very important. And now they've shown a diagnosis that supposedly isn't what they call insignificant, what we wouldn't call insignificant, is vasculitis, meaning inflammation of the blood vessels of the brain. Quite common when you read an MRI. Well, that's not insignificant, because you see, if you start having inflammation in your brain, that's not a good thing. Because after inflammation, just like when you have arthritis in your knees, you kind of have those little deposits, those toxins, or, and it impairs function. So we don't want inflammation in the brain. And another thing that also really affects the brain in two ways is stress. Stress, when you're stressed out, you're activating certain neurotransmitters that puts the brain on fight or flight constantly, and gets those neurotransmitters that are really energy consuming for the body, the glutamate, the fight or flight neurotransmitters. So that is harmful years after years for the body. But also stress is harmful because it affects your lifestyle. When you're stressed out, and you're actually making poor choices. And poor choices results obviously in inflammation of the brain. If you eat junk food and don't exercise at all and forget to eat healthy food, then we're having a problem. So there is such a thing as the brain diet as well. So what is the brain diet? And the protective diet for the brain is a lot of fat. 30% of your food should have some fat in it. That includes the walnut, which by the way look like a brain. It includes the good fats, so if you're not vegetarian you can have the wild Alaskan salmon, that's really good. The fish oil that you can take nutritionally, especially high in DHA. DHA is good for cognitive, it's good for memory. And just olive oil, grapeseed oil, avocados, I'm sure I'm forgetting, but a lot of good fats. Fats does not make you fat, fat makes you smart. So that's important to remember. And so I think we've covered the major aspects of protecting your brain. There are some specific nutrition supplementation that will actually help you detoxify your brain. But I want to close out with you remembering that inflammation of the brain will cause neurotoxicity and can cause vague symptoms from balance, memory, irritability, moodiness, insomnia. All of that is affecting your brain. Those are not separate doctors that you have to see. Those are basically, your nutrition that you have to improve to actually improve your brain function. So that's what I want to close with. The brain is part of the body, and improving your brain function can actually be accessible to you. You can do that. And, the specific supplementation will depend on your blood work and will depend on your specific condition. But overall, remember the good fats, the exercise, the B vitamins, specific brain fats, and overall diminishing stress or the perception of stress. Thank you.